Let's go on. Non-steroidal anti-inflammatory drugs include many agents with different chemical structure. Acetaminophen and phenacetin. Acetaminophen is the active metabolite of phenacetin, responsible for its analgesic effect. It is a weak prostaglandin inhibitor in peripheral tissues and possesses no significant anti-inflammatory effects. Acetaminophen is one of the most important drugs used for the treatment of mild to moderate pain. Pain and fever is so common symptoms of many diseases. It is very common used in our daily life. Phenacetin, it is more toxic and has no rational indications. But acetaminophen, in the treatment of pain and fever, it is more popular than aspirin. Acetaminophen has another name, paracetamol, and sometimes it also caused by Panadol. In Chinese, it is called 扑热息痛. This 扑热 means relief fever. 息痛 means relieved pain. That's why it is commonly used for the relief of fever and pain, because its antipyretic and analgesic effect is similar to aspirin, but it has no anti-inflammation and effects on platelet function. It is mostly used for the treatment of headache and fever. Its adverse reactions compared with aspirin is relatively mild, but it also induces allergic reactions, nausea, and vomiting. Once it is used in overdose, it also has hepatic damage because the metabolism of acetaminophen, similar to aspirin, it also in the liver, and the liver metabolism function to acetaminophen, it also has limitation. Allergic reactions is also relatively has more incidence, like this picture show. A woman, after she has used acetaminophen to treat pain during menstruation. It has a regular erythema on the shoulder. This is one allergic reaction caused by acetaminophen. Although this is relatively safe, so actually this drug, it is very common used in our daily life. Here in China, these compounds that used to treat cold contain acetaminophen, and because it is safer than that of aspirin, so in the treatment of fever in children, it is very common used. But this drug, although it is safe, but the body elimination to acetaminophen still has limitation. Usually, the dose should lower than 2 grams in a day. So actually, because this drug is so widely used, and there are so many compounds that are used to treat cold contain this substance. So this year, the latest revised instruction for acetaminophen by China State Drug Administration, there are some changes. This drug can induce serious adverse effects on skin, allergic reactions. And when it is used in overdose, it also induces serious hepatic injury. So this instruction suggests in a day, the dosage of acetaminophen don't exceed 2 grams. And also don't use this drug in combination with some other compounds, including acetaminophen. Once intoxication caused by acetaminophen diagnosed, use this specific antidote, N-acetylcysteine, as soon as possible. Acetic acid derivatives, indomethacin. This drug is an indole derivative. It has anti-inflammatory, antipyretic, and analgesic effects. These effects are remarkable. Actually, it is one of the most potent COX inhibitors, so it also has more adverse effects. Because it is very potent anti-inflammatory drugs, it is usually used in the treatment of rheumatoid arthritis, stiffness of osteoarthritis. But it is very potent drugs. Say its adverse reactions also is relatively severe. It also has cross-relatability with aspirin. Ibuprofen. This drug, it also is available over the counter and widely used in our daily life. It is one propionic acid derivatives. In a day, 2,400 mg of ibuprofen has a similar effect of anti-inflammatory effects as 4 gram aspirin. So it means it is more potent than aspirin. It also can be administered orally in lower dose, used to treat pain, but has no anti-inflammatory efficacy. So in our daily life, it is commonly used to treat rheumatoid arthritis and other inflammatory joint conditions. Diclofenac. This agent is one relatively new nonsteroidal anti-inflammatory drug. It is more potent even than indomethacin. Its analgesic, anti-inflammation, and antipyretic effects is about 26 to 50 folds of aspirin. So actually, in the treatment of arthritis, it also is more popular in the patients with arthritis. But actually, it also has relatively more adverse effects. And the latest revised instructions for diclofenac by State Drug Administration include this drug also induces serious allergic reactions, including an allergic shock. Even it also occur collapse and hypotension in the patients. So just use this drug for a short term, don't for a long term. Celecoxib. It is one selective COX-2 inhibitor. Because COX-2 is a inducible COX, much more related to inflammation. So compared with non-selective COX inhibitors, celecoxib has relatively less adverse effects related to COX-1. the incidence of gastric toxicity is much lower than non-selective COX inhibitors. It is widely used to treat osteoarthritis and rheumatoid arthritis. Like this picture shows the patient has this rheumatoid arthritis. But because it also has an inhibition on the COX in endothelium cells, so it has problems with cardiovascular system, cardiovascular safety. So for the patients with cardiovascular disease, do not use this celecoxib. Try to prevent the risk of cardiovascular events. This is opposite to aspirin. Okay, that's all for this chapter. I also give you several questions. Include aspirin's pharmacological effects and therapeutic applications. These effects include 5 points, and applications, include various pain to relieve fever, diagnose acute rheumatoid fever, used to treat arthritis. Yeah, it requires a relatively large dose, and used in the cardiovascular application to prevent thrombosis, and used to treat Kawasaki disease. Don't forget that. Adverse effects of aspirin include 6 points. Do you remember? GI tract reactions, blood coagulation drawback, hypersensitivity, hepatotoxicity, including Reye's syndrome, salicylate intoxication, and renal injury. Try to remember them very well, okay? And can you fill in this blank? The antipyretic and anti-inflammatory effects of non-steroidal anti-inflammatory drugs are primarily due to inhibition of prostaglandin synthesis by inhibiting COX. Okay, these drugs you have studied in this chapter, they usually used to relieve fever. You try to distinguish them from chlorpromazine. And they also used to treat some inflammation. Try to distinguish them from glucocorticoids. And they also used to treat pain. So try to distinguish atropine and morphine. These 2 drugs also used to relieve some pain. Atropine used to relieve some pain related to smooth muscle spasm. And morphine, to treat some severe pain, you usually choose morphine. For mild to moderate pain, we often choose aspirin or others, and as AIDs. Okay, that's all for this chapter. You will study diuretics in the next chapter. That's all. Thank you.